In fact, I think that brings me really to my last question, specifically about gun violence. If we know, I tend to ask my patients, do you have a firearm in the house? Let's say they're in the hospital. We know there was some risk factors for either suicide or harm to others, and we know there's a firearm in the house. Are there any special steps we need to take there? So there's no active threat, but we do know they have an access to a firearm scenario. How would you approach that? And again, I know these are gray zone questions.
Well, I would ask you to step back and again consider the duty to warn law.
Okay.
Partially, is the person making a threat of credible, imminent, serious physical violence? Is it really rising to that level where you need to do a duty to warn? Certainly, a person who has a gun already, if there is any chance of violence, that threat will be serious physical with a gun. So you've already got one of those criteria satisfied. So that is right to get your sense that this is more serious. So think about the duty to warn law. There is also a law in New Jersey that if a person's in a non-correctional institution, you as the practitioner are allowed to call a family member, even without the person's consent, if you think it's for the benefit of the person. Most people are not aware of that law.
You can call the spouse, for example.
Yes, you can. In that case, I would say you probably should. The law doesn't talk about in an outpatient setting, so it's silent on that. But it's the kind of thing, since it talks about it in a institution, if you really thought it rose to that level, you might want to speak with your patient and say, look, I'm very concerned. You've had this history. You're upset now. We know you have guns in the house. Things happen when people are upset. I'd really like to speak to your spouse or your partner or your friend and talk about just the gun, frankly, getting rid of it for right now.
So seeing if you can either secure it, get rid of it, and one can take it to their local police department, I believe. Is that right?
Yeah, let's get into that. We didn't do the second part of the duty to warn, which is when you have now incurred a duty to warn, the person is either making a threat or you believe they're going to intend to commit violence.
Yeah.
What do you do? Okay, the old part of the duty to warn law is you can do several things. You can arrange for them to be admitted voluntarily or involuntarily admitted to a hospital. Let's say, assuming their risk arises from decompensated schizophrenia.
Okay.
Get them into a hospital. That's one thing, to discharge the duty. Another one is to advise a local law enforcement authority of the risk. That's particularly true if you're not planning to hospitalize them or they're not mentally ill. They're just dangerous.
You just call the local police department, let them know who you are, that you have a patient, and you can release their name.
Yes.
And that, and just advise them of the scenario that's occurring.
And particularly the intended victim.
I see. Okay. And make sure you also have so you do need that person's name, obviously, if you can.
Right. The other thing that you can do is you can call the victim himself or herself of the intended threat. That's another thing that you can do. It also talks about suicide. If the person's under age 18 and threatens to commit suicide, you can call their parent or guardian. So those are the standard duty to warn elements that have been in the law since 1991. Again, what has been added in June of this year is the requirement when the person does convey this threat or poses a threat, and you have this duty to warn, you now must call the local law enforcement authority and let them know of this threat. And what will then happen is the law enforcement authority or the state police, if there's no local police department, will do their part as required by law to see if the person has guns and whether the guns should be removed.
Okay, so at that point, you document that. And can you do all of the above, or it really just, you really should do all of that?
The rare times that I've had to do it, it's even rare in my business in forensic psychiatry. It's not often. I've done both. I will call the police and I'll call the victim. And sometimes if they're decompensated mental illness involved, you're going to hospitalize them too. So yeah, I would cover all my bases on that. But now the thing is you have to call the police. I know psychiatrists have protested this. They talk about how it's an expansion of the standard of care. Well, it is, but that's what the public is demanding of us. And in a certain way, if you approach this in a thoughtful way before you take the person on as a patient, so first meeting, you inform your patients of the various scenarios that require mandatory reporting, such as child abuse reporting. We're already required to report that. You give them these situations that I'm going to take you on as a patient, but here's what I have to do if the situation arises. Mm-hmm. And you show them this, you have them sign it, single piece of paper. Mm-hmm. There's actually a study that showed that when practitioners did that, it either didn't hurt the therapeutic relationship mm-hmm. when that provision had
to be enacted,
or it actually improved the relationship. Mm-hmm. What you preferably don't want to be in the situation is you just sort of spring this on the person, you call law enforcement, and you don't even notify your patient.
I really like the idea of transparency, right, initially, and then both people are on the same page, and I agree, usually patients are not as reactive, right? When you do take that step, like, okay, I knew that was going to happen. So again, I just want to highlight the new change is the particular piece in calling the police. Yes. That's the particular add-on now.
Yes.
Can you just highlight that again?
Yes.
Just so the viewers.
The addition to the duty to warn law in New Jersey is the requirement that when you incur a duty to warn, you now must call the police. It's not an option. Mm-hmm. And the purpose of that is the police are going to essentially look for guns and perhaps approach the court as to whether the gun should be removed.
So really that, out of those options, hospitalization, warning the victim, and obviously calling the police one really is kind of at the top of the list.
Yeah, it's
in
mandatory.
A way. Now it's mandatory, right. And before, again, this might sound a little naive, but so I thought if one believed there was intent, even prior to this, that we were mandated to call. So it wasn't a mandatory thing before.
No, it was an option.
I see. So now we have to do it.
Yes.
Now, in terms of in the child situation, right? There's a suspicion there, but here the intent has to be somewhat clearer.
That's the way the wording is in the law.
Yes, wonderful. Dr. Reeves, thank you so much for sharing your thoughts with us, and thank you all of us for joining us today. And please join us for our future series. This is Dr. Reeves and Dr. Janeja saying thank you.
Thank you.